My name is Silvanus Ilomo. I'm Director of ICT, Minister of Health in Tanzania. And DHIS2 is one of the digital systems that we are implementing in our country. Basically, as you know, that Tanzania is one of the biggest countries in Africa. So having HMIS data from grassroots to the national level is one of the very hectic job. So at start, we are using paper by collecting data from facilities up to national level. So you may find like we have like 11,000 facilities countrywide. So we find it's a very tough job to have those all kinds of data from facility to the national. So later on, we as a country decided to start with the using of DHIS2 system to make sure that we manage this data which we have been collecting from the facility level. So DHIS2 is one of the global products which really assist us to make sure that we capture data on time with big accuracy. Compared to paperwork that we have been doing before, so it's even easier doing different analysis using the system. Is fast, accurate, and you may do a big data analysis rather than using paper. You may find that it's a hectic job doing one by one, collecting one by one. So DHIS2 is one of the systems in our country which means a lot for us. Also, we use DHIS2, like you say, our country HMIS data system, and basically we use to integrate with other digital systems. So there's an exchange of data, DHIS2 with other systems that we have from the facility level. Like some of the facilities we have been implementing electronic medical records, some not. So for those which we have already implementing electronic medical records, we have already integrated with the DHIS2. So we are getting data direct from the facility to the DHIS2. But also we do integrate DHIS2 with the logistic management systems to make sure that we have a proper, the use of consumption data for logistic management vis-a-vis number of patients which are attended in the facility. So you may find for us, it makes our work to be easy because we can make an intervention with the requirements of maybe kind of medicine that is supposed to be sent to the facility that we have in our country. So that's an area also DHIS2 means a lot to we as a country. Basically it helps a lot because first we know what kind of medicine is mostly used in our facilities, because we get aggregate through DHIS2. So we may find on that aggregate we can see how many patients and what kind of medicine which is mostly in the consumption at the facility level. So it helps us, we as a government, to make sure that we order medicine which are mostly used in the country, to make sure that we avoid even sometimes the expiring of these logistic materials at the facility level. Malaria is one of the diseases that we are really using DHIS2 and logistic medicine to make sure that we get the intervention of malaria from the level of facility to the national levels. It helps to make sure that we are not ordering more than what is required at the facility level. So starting with the malaria, somehow we are doing well with the DHIS2.